Sir, I don't want to be. I don't want to be in that clinic at all. Like to move back down there where I was seeing Doctor Yolande. Yes, And then she moved away, and when I went in there to ask for a new doctor, they said, just come in and do a walk-in, and it's hard for me to spend, more than an hour and a half down there. My back starts hurting me so bad. No, sir, I'm not taking methadone since February when they poisoned me in the ER down there with that Narcan. I didn't want to go back to their clinic at all. I'm not a drug addict, sir. I've just got back pain. That's how this all started. Dr. Ghost, my primary care doctor, sent me up there for back pain, and they put me in this methadone program. And it subsequently has ruined my teeth and it's done nothing to address my back. It's just gotten worse and worse and worse. And um, the and I have no confidence in Dr. Farimo or that whole department down there. I would just like to see a psychiatrist for my depression. And then I'm working with my primary care doctor. I have an appointment there on Friday for her to look at my back MRIs to see what the next step is with that. That's correct. And his like I said, I know I went down there Friday per his request, trying to be placid and I don't know what's the word I'm looking for, but going with the flow, right? So he says, when you come down here for your lab Friday, just come up there and tell him that you're here, and I'll see you. And so I went up there and said, hey, I'm here. I saw him he walked out into the waiting area, and I said, Dr. Fermo, and he looked at me. He says, who are you? I said, I'm Slade Fuquay. And he's like, and why are you here? Is this? And he looks at the scheduling desk and says, is this another one? I said, no, I'm not another one. I'm just going to go back down to that other department. I've already asked him twice to get me a different doctor, and he keeps calling me back. And when they sent me down there to the Harris County Psychiatric Hospital for 6 days and told me that somebody from the VA was going to call to follow up with that, it was him. And I told him again that I wasn't interested in that. But he made all these promises about some PAC committee or something that was going to get assigned to me, and just more empty promises. He hasn't done anything he said he was going to do. It's just unacceptable. I need to see a doctor that doesn't have such a high patient load, or that can manage his patient load more effectively. Uh, that can help me with my treatment. I mean, it's like every time I go in there and see him, it's like we're starting from square one. I'm having to relive all this stuff every time I tell it to somebody. It's making it worse. Yeah, this is my phone number. I'm here in a ghetto on the north side, so the strength of my phone signal sometimes is weak, but generally, this is the only phone number I've got, and I can be reached by email. But this is my preferred communication. It's by phone. Okay, alrighty. Thank you so much. Bye bye. Okay, that's Dr. Garza. That's Dr. Garza. Uh, he was the one, that I mentioned previously that, he had spoken with the guy that I saw there on Friday and said that they were going to call me with the scheduling thing, and called me and tried to schedule me to see Dr. Fairmo again on Saturday. And like I just told y'all, I don't want to see Dr. Fairmont anymore. I'm suffering from back pain, and I don't know why they're doing this to me. Why they're just letting me suffer like this. I'm suffering to death. You know, they're helping me to death. I'm unrecognizable from what I was 6 years ago. You know, now I'm just sitting here. I can barely sit in this chair. You know, I just want to lay down. When I lay down, I can't get comfortable laying down. Start getting cramps. Cramps around my rib cage. Anytime I try to pull myself with my leg to get my legs in a different position, my legs cramp up. I'm having problems with my urethra, with my anus. Having muscle tone. I've got muscle tone problems all over my whole body. You know, which was not such a big deal until that Narcan incident. You know, it just that Narcan I think has done neurological damage to my body. The few things that I've been able to find on the internet, you know, contradiction for that Narcan is not something you use on a long-term methadone program person, you know, and that, you know, you're supposed to administer that drug carefully and monitor it and not just slam somebody with that stuff and run out of there and let them just jump around in there like a chicken with his head cut off, which is exactly what they did to me. Dr. Fairmont sent an ambulance to my house and took me to the VA hospital. When I got to the emergency room, I was not in any critical condition. My vital signs were all fine. Houston Fire didn't even want to transport me because I was in no serious health risk in their determination. And they transported me anyway at the request of the VA, which I got a bill for $1,200. And so, you know, I went down there to the VA and thought I was going to go down there and see this Dr. Fairmont. Not because I wanted them to save my life, but because I was still alive and I was going to have to deal with the aftermath of not having methadone for my back, which I knew I wouldn't be able to survive. And I'm barely holding on right now. I've already been hospitalized again since then because of my back pain. And they did the same thing to me. They sent me to a psychiatric hospital. They mistreated me up there at the Northwest Hospital, refused to acknowledge my complaint, and just strapped me to a bed down there because I wanted to leave after 6 hours of not seeing a doctor. But that's a whole different thing, you know. I guess probably get somebody to help me with that, but that's not what it's about. You know, it's just about me staying alive right now and surviving this chronic back pain that the VA is just refusing to acknowledge. You know, and despite the physical evidence of it being bad, they just ignore that, I guess, and just there's nobody to hold them accountable for what they're doing down there, so they just do whatever heck they think that they want to do, you know, whatever their I don't know. So, you know, just like the Narcan thing, you know, I get down there, I'm not in any immediate risk. I ask for a drink of water. The head ER guy says, well, we'll give you a saline. But what is that going to help me with my dry mouth and my throat? You know, this stuff makes me cotton mouth real bad, and you're telling me that I can't have water, that we're going to give you saline, and then they give me a bag of saline, and they come in there and they inject some poison in there that puts me into this acute withdrawal, and they just run out of there and leave me in there flopping around the floor with blood and puddle of blood and mucus was just coming out of my mouth. It was just pouring a copious amount of music just flowing out of my mouth, and my IV had gotten jerked out. Maybe I'll make that my thumbnail on here. You know, my IV got pulled out, and was begging for somebody to help me. Please help me. This stuff is causing some violent reaction in my body. It's my whole skin was, my whole body was on fire, like just burning, like an ant bite fire, but all over my whole body at one time. You know, it was like washed down me. They put that stuff in there, man. And I got real dizzy. I knew something was wrong. I said, hey, stuff is making me sick. And this heat came down my body, and then I just got scared, you know. And then another wave of heat came down my body, and I pulled out my IV, thinking that I would stop whatever was coming in from coming in anymore. I pulled off my shirt because my body was burning. I kept pulling my pants out, trying to get air. So it wasn't the air wouldn't do nothing for that. It was all nerve associated with nerves, and this mucus starts coming out of my mouth, and there's blood coming out of my arm, and it's all in the floor. I'm crawling around because I can't. My back is so messed up I can't hardly walk. And they're crawling around and they were asking somebody to help. You know, eventually I did stand up, and I think that's all that convulsing and stuff. It jarred this steel in my back loose, because now the steel in my back is hurting me real bad. You know, when I was complaining about this being messed up, and they said, "What's your neck?" You know, and it took me a year just to get them to stop looking at my neck and do an MRI of my back. You know, and I'm gonna post that on there. I'll put all these MRI reports and everything online. I got nothing to hide. I'm dying. You know, if I'm alive next year, it'll all be worth it. If I don't make it, you know, I just want there to be at least maybe that this will save somebody else. You know, that the VA is neglecting people down there, and they're covering it up. They won't acknowledge any complaints that you make. As a matter of fact, you make complaints down there, and then they mistreat you even more. Excuse me. Oh. So it hurts me so bad to change positions like that, and the left side of my back just wants to cramp up. It's just constantly tight. But this is the only medication that I'll take from them. Just gabapentin. You know, it keeps my feet from burning, but that's all. That's all I'm gonna take. That's all I'm gonna take from them. You know, they want to give me antidepressant medication for my back pain. It's like, well, we know that your feet and your legs are burning on fire right now, so we're going to give you some antidepressant medication for that. No, you got a broken leg, but we'll give you some antidepressant medication for it. You know, it's just like my shoulder. I fell down in the hospital up there and hurt my shoulder, you know, and nothing ever came of that. They said, oh, well, yeah, there's nothing we can do about that because your neck's messed up, so you just have to live with it. And now it's, you know, healed. I don't know, is that stuff healed? Will it heal wrong? No, I'm messing this thing up. Let me stop now.